Hi, my name is Madeline Welch, and I'll be presenting my surgical nursing kit. My kit is for a 54-year-old client who had a left-sided hemorrhagic cerebrovascular accident. My client is a right-hand dominant surgical nurse who plans on returning to work within the next 6 months. My client is currently two months post-CVA and is attending outpatient occupational therapy 3 times a week for 1-hour sessions. My client is also receiving speech therapy as well as physical therapy. My client is currently at a Brunstrom level 5. My client has limited range of motion in his right upper extremity, as well as limited pinch strength and grip strength in his right extremity. My client wears a shoulder brace to prevent subluxation of his right shoulder. He currently has limited range of motion of his shoulder. My client shows signs of weakness in his rotator cuff, his trapezius, latissimus dorsi, rhomboids, and does not have any signs of scapular winging. My client's current goal is to improve upper extremity function so that he can return to work as a nurse. My question under study is, among patients who demonstrate upper extremity weakness, is task-specific training effective in improving upper extremity function in order to complete nursing-specific tasks? I created this kit with meaning and function behind it because of my client's volition to return to work as a nurse. My client valued his role as a nurse, not only because it was meaningful to him, it gave him independence and was a means for financial stability for his family. The tasks in this kit are all simulations of tasks that you would see as a medical professional. The tasks are all performed by the upper extremity. These tasks require balance, functional endurance, pacing, heating, stabilizing, enduring, as well as grip, reach, and joint stability. The kit challenges all of these skills as well as brings meaning to my client. This kit integrates best evidence-based practice because it is client-centered and it is built with tasks that are task-specific training. In a 2015 meta-analysis, Quackel, Veerbeek, and Wolf analyzed over 467 trials. Over 467 trials of task-specific training and constraint-induced movement therapy were analyzed. These trials were consisting of randomized control trials and used standardized assessments such as the Wolf Function Motor Test as well as the AREC, the Active Research Arm Test. These trials showed efficacy in improving upper extremity function in adults with CVA. My kit can be used while seated, standing, or in the quadruped position for increased difficulty. The kit includes 1 box with a lid, a simulated ambu bag, 2 syringes, only 1 is needed, and a simulated syringe packet. The syringe packet velcros on. Once the kit is assembled, the client will start with the simulated ambu bag, squeezing, and then move on to tearing the alcohol wipes. The alcohol wipes consist of simulated Velcro strips. There are 5 strips. Once the client has torn their alcohol wipes, they can move on to the simulated area of where they would wipe and prep for an injection. Using both hands, then the client will open up the syringe packet using a pinch, and then they can take their syringe and with gentle force pop it into the syringe hole, simulating an IV or a vial. They can flush or practice drawing out medicine out of the vial. This can all be performed in a sequence or individually. Increased difficulty, they can perform this in quadruped position, balancing on their unaffected arm. They can also increase the reps of squeezing the ambu bag. To decrease difficulty, they can perform this sitting, and they can also use their hand, their unaffected hand, to stabilize as they use their affected hand. Although I was unable to implement my kit due to the COVID-19 pandemic, I know that my client would have truly enjoyed my kit because of his volition to return to work as a nurse to help others. He enjoyed meaningful tasks, including nursing as well as weightlifting. Although the kit is easy to use, there are a few contraindications. If the client is at risk for shoulder subluxation, you should make sure to monitor your client closely.